Morning, good afternoon, and good evening to all the participants in this webinar today. I'm Dr. Purnima Prabhakaran, Deputy Director of the Center for Environmental Health at the Public Health Foundation of India. On behalf of the hosts, our center, the Health and Environment Leadership Platform at the Center for Chronic Disease Control, and Healthcare Without Harm, it's my privilege to extend a warm welcome to all the panelists and the participants to this important discussion this afternoon. So the theme of the webinar today is the management of waste in the COVID era. So all of us recognize we are living in extremely difficult times. The pandemic has been around for almost 6 months now in some parts of the world, and it has impacts across various domains of health, economy, as well as the social fabric of different geographies around the world. Yesterday we celebrated World Environment Day, and at one other webinar we were discussing what has the impact of the pandemic on the environment. Like if we were to think of it as the good, the bad, and the ugly, the good is pretty evident. We all recognize that the lockdown situation has helped to rejuvenate nature, and we are seeing air that is cleaner and easier to breathe. The water bodies are looking more pristine with all the industrial effluents and all being shut down. But the ugly part for me has been, of course, the crumbling of the social fabric and the visuals of the hordes of migrants crisscrossing across the country will be with us for years to come. I was thinking of what the bad part was for me, and I think the bad probably is sometimes, I think despite us being fortunate enough in India to have very comprehensive waste management rules, whether that's for the solid waste management, for the healthcare waste management, the biomedical waste management rules, as well as the guidelines that the CPCB, the regulatory body, came up with so quickly, for the COVID waste as well. There has been some concerns raised and some confusion on how waste has to be managed, not just in terms of the solid waste management. It has crumbled in many of the resident welfare associations have been talking about it, raising concerns that the whole life cycle of waste management has crumbled for so many reasons. The lockdown has prevented the waste collectors, the handlers. So when we're talking about the healthcare facilities, there have been various other forms of concerns that have been raised. And the quarantine centers, the isolation wards in hospitals, all of these have seen different challenges in waste management. So we thought it was very apt to bring together some experts from all the different domains to provide not just national, but international perspectives as well on COVID waste management, the key challenges, the key opportunities that we have to improve upon the way we are handling our waste. So this webinar today will have perspectives from different domain experts, and we will follow that up with a panel discussion. And then we will take questions from the audience. I'm sure there will be lots of queries from the audience on different aspects, whether that's healthcare facilities or the solid waste management. And I will hand over now to my colleague, Ms. Ananya Tiwari, Senior Research Associate at the Center for Chronic Disease Control, to introduce the speakers and move us on in the agenda this afternoon. Ananya, over to you.
Thank you, Dr. Purnima. Good evening, everyone. My name is Ananya Tiwari, and I work with Dr. Purnima. I welcome all of you to this webinar on waste management in the era of COVID-19, which aims at highlighting some very important aspects around waste management during the current pandemic. Beginning with our first segment of the webinar, I would like to introduce our first speaker, Ms. Stringer. Ms. Stringer is the International Science and Policy Coordinator for Healthcare Without Harm. She coordinates their work on waste and also provides expertise in chemical, pharmaceuticals, and procurement. She's a member of the International Solid Waste Association Healthcare Waste Working Group and advises on waste management policies internationally. Today, she will be presenting on international perspective on healthcare waste management during COVID-19. Over to you, Ruth.
Thank you very much, Ananya, and thank you for the opportunity to speak today. You just give me a second. I think I can share my screen. I hope everyone can see the screen correctly. Ananya, is that okay?
Yeah, now it's fine. Yeah.
Lovely. Okay, now my, excuse me one second. I just need to have some small adjustments here. Okay, fantastic. So thank you very much for the introduction. There we go. And I'm going to move straight on with the presentation. So as I said, I'm going to give the international perspective on how to deal with waste from healthcare facilities during the coronavirus. In some respect, the international guidance differs from the guidance which is given from India, because globally, the advice that we've given is that you simply need to adhere to your existing system. If your system can cope with the waste during the ordinary days, then we should be able to do it in this term as well. And the fact that India has given specific guidance for coronavirus is actually, it teaches us lessons globally, because I think some of the changes that have been made highlight areas in the system where people feel that they may need to be reinforcement. And so we can take this as a lesson and a reminder of not only what is important about the systems, but where we can have a longer term reinforcements that will give us a system that will work not only in coronavirus, but in the long term and in case of some other disaster that befalls us, be it a cyclone or a disease outbreak or so on. So this is a very important thing to do. Okay, next slide. So the sources of waste are going to be just the same as normal, from potentially infectious patients and the staff caring for them. And this is going to, of course, it's including a lot more PPE. Medical labs will be processing a lot of samples, no change there. In the community, establishments like shops will not normally generate potentially infectious, may be doing so because staff are wearing PPE. And then people are self-isolating at home with mild illness will generate potentially infectious waste, such as used tissues. But as well as the source of waste, we need to ask ourselves, how might this waste spread the infection? All the research we have points to two ways which can be spread, from infected people and from contaminated surfaces. There is no evidence yet that surface contamination is re-aerosolized. So as long as everyone is handling waste, wears the usual PPE, protect them from direct contamination, and maintains good hygiene, there should be no extra danger. But people are also concerned about things like food waste, and we're hearing they want to put into the yellow bag for incineration or use throwaway plates. And there's no need to know this. And I know that other experts on this panel have been advising against it. But there's a lesson here, is that people that are generating the waste on the wards need more advice and reassurance about this. And so we need to have proper training and refresher training, so that people are confident in how they're handling waste. And this is something that should be done universally and strengthened universally. There we go. Management of waste at source then. So the international group's most important message for healthcare waste is that the best practice needs to be maintained and reinforced. Waste from known coronavirus measures may need to be classified as infectious, but other than that, just keep your normal segregation system. We also advise against expanding the definition of waste which are infectious, and there is no need to classify as highly infectious. The worst problem I've heard of, apart from the problems where places don't already have segregation, is places like Italy, which classified all waste from hospitals as treating coronavirus as infectious and overwhelmed a perfectly functional system. And the advice to cut masks and PPE, which has been in place in India for a long time, and it isn't in place in other places, because we know that there is illicit recycling of medical waste. So we need to shut these down. There's already, action on this, but it's not enough. There are people that are at risk every day of the year from illicitly recycled medical waste. And it's not just because of coronavirus, but because of hepatitis, TB, HIV, and all the other diseases that can be spread this way. To protect our healthcare workers, this is absolutely vital. They should have the standard personal protective equipment. They should have dedicated boots or shoes, a waterproof apron or long sleeve gown, face protection, so some mask, goggles, or face shield. They don't need the N95 or FFP2 mask because they should not be exposed to aerosols in the same way as healthcare workers. But they do need to be protected from splashes, including splashes to the eyes. And so the goggles, mask, and face shields can also deter them from touching their faces. They need to be trained on how to put on and remove the PPE. It's not done the right way. They're at risk of infecting themselves. And also they to perform hand hygiene after removing PPE. And I see too many places where they don't have the correct PPE, or they don't have, places to do hand hygiene. So not just for coronavirus, long term, we need to make sure that they have access to the right equipment, that they are properly trained in how to use it, and that they have all of the hygiene facilities that they need. They also need to be protected against other diseases where they're outsourced or where workers are not full employees of the hospital. They may not be offered the same vaccinations as healthcare workers have. So they need to be protected against HIV, hepatitis, tetanus, free of charge and routinely. Transportation and storage. We know how to do this, right? Collect waste once a day, maintain segregation, use a wheeled bin, and so on. And some places, India included, are recommending double bagging. That shouldn't be necessary. If you've got a good strong bag and it's placed into a leak-proof container and wheeled away, and then this leak-proof container is, transferred into the vehicle and that goes on, there's no need for double bagging. So the message about double bagging tells us that we have a fear that there's weaknesses in the transportation system. So let's reinforce those. Let's make sure that the trolleys are there. So many places I go where you see that the waste worker is simply carrying the bag in their hands, which is opening them to, there may be dripping from it. They may be getting needle sticks from the bag. We need to have a better system for this. Then when we come to treatment, here we have this is from KGMU, this very nice autoclaving system. This is the sort of system that many hospitals can have if there isn't a centralized weak treatment facility available. So the global advice from the Stockholm Convention and from the World Health Organization is that we need to be avoiding incineration. We need to be using alternatives like steam-based disinfection. And yet during coronavirus, we're seeing people saying, well, we need to incinerate more. This is exactly the wrong way for us to react during this. WHO and the international waste management community is advising for no regrets investment. So don't put in place anything that you don't want to do in the longer term. So if more waste needs to be treated, then we may need to have, better capacity for autoclaving. We may have better staff to be able to put on shifts. But what we mustn't do is start moving towards incineration. We mustn't start using disposables like so on that are unnecessary and that do not, in fact, give us a proper any extra safety. You know, there's no, a disposable plate is not safer than an ordinary steel one to be washed properly. Maybe the investment needs to be in washing machines for the kitchen. That's an investment that we will not regret. But if we start moving to disposables, then we will. Okay. Then lastly, I just want to talk briefly about in the environment, in the community environment. And here we find that, you know, we're getting more PPE, and people are worried about whether stuff that's coming from the household needs to be treated as infectious waste. The international guidance is that waste from households should continue to be treated in the same way before, and not as biomedical waste. The chance of this waste containing coronavirus is low, and as with so we need to advise people not to disinfect waste. You know, but if you're disposing that or other PPE, cut so that we can prevent rag pickers collecting them for reuse, and always to wash your hands after handling masks or other waste. And Public Health England advises that if waste from people at home with mild symptoms is held for 3 days before being put out for collection, it'll reduce the viral load so that it's treated like municipal waste without risk. And as I'll talk a little bit more later about the need for municipal waste handlers to have the proper protection as well. But for now, that's my presentation, and thank you very much for listening.
Thank you, Ruth, for this interesting presentation. Moving on to our second speaker, I would like to now introduce Dr. Shamla Mani. Dr. Mani is a consultant with the Center for Environmental Health. She has 35 years of experience in the field of education and policy, and has contributed to the formulation of several waste management regulations in the country. She's been actively involved in the projects and capacity building of urban local bodies under Swachh Bharat mission, and is also the team lead of waste management exposure workshop. She will be presenting on role of IEC in capacity building in improving biomedical waste management. Ma'am, over to you.
Thank you so much, Ananya, and good afternoon to everybody. So I'm going to be speaking on the role of information, education, communication, and capacity building in improving biomedical waste, especially during COVID. But to tell you the truth at all times. So I won't dwell too much on this. Everybody knows about it, SARS-CoV-2. Like Dr. Malini has been telling us and Ruth just mentioned, it's not a hemorrhagic virus, and it is with lipid coat. So that's what we really need to keep in mind for waste management. Just now, I just checked with the television, and it says that we have crossed 236,770 cases. We have crossed the cases in Italy. So we are number 6 now in the world. The deaths are low because it's demographically a young country, and also a lot of recovery is happening. And thanks to all our COVID warriors and our doctors and all microbiologists who have helped us. Like Dr. Purnima mentioned, there have been some good effects of corona, that air and water and environment has improved. But this is the new normal, people working from home, and everybody has been advised wearing face covers, what they are called now, instead of being called as masks. And this clearly shows that with or without mask, definitely the viral load and the aerosols in the environment are much less. So even the WHO's advisory today very clearly says that, of course, mask alone is not enough, but you know, it is important in wherever you go out. So the most important thing is that in spite of all the checking and testing, a lot of PPE is being generated. Now this person is also sometimes wearing PPE, but at least definitely gloves and masks. The status of biomedical waste, like we already know that the bedded hospitals are almost 1 lakh, And the non-bedded all-inclusive is about over 2 lakhs. That is 200,000. And we also have 559, about 600 tons every day. But this is now doubled during COVID time. And also there is violations, which Ruth mentioned, which is being addressed by the CPCB. Yutika will talk about it. We have over 200 common biomedical waste facilities, which are trying to address this entire biomedical waste issues. And of course, there are captive biomedical waste treatment facilities in hospitals, which are not being able to be connected to the common biomedical waste. Sorry. So the categories are, as you already know, yellow, red, white, and blue. Yellow is the insoluble, which has got the anatomical and the microbiological and the pathological. Red is most of the one-time plastics, mostly, and they can be autoclaved. And white is the metal sharps, and the blue is the glass, whether it's broken or unbroken. So normally, this is what we have seen in a hospital, that over 70% is general waste or uninfected waste. And this is the approximate percentage that we found of yellow, red, and this is blue and white together, sharps. And this is what has been followed even before COVID. That is, the general waste is separated. Sharps are either disinfected or autoclaved and recycled. And infectious waste, here all the anatomical waste in remote areas, it can go for deep burial, but otherwise it goes for incineration. And this autoclave is basically for the blood bag and vacutainers or something, then they can go into for incineration. Chemical liquid, if you have the Karnataka model, the wash basin model, you can disinfect it then and there. That is for the liquid waste, chemical waste. All the solids, some of it goes for incineration and some of it is returned to the manufacturers, or it has to go for deep burial. All radioactive waste goes to bark. And then you can see that the treatment of liquid common effluent treatment is now absolutely mandatory in ETPs, and the sludge can go to TSDF. Infected plastics, again, except the blood bag, which goes for autoclaving and then incineration, everything else goes for autoclaving or hydroclaving and shredding and washing, and then it is recycled. So this is what the CPCB has said about biomedical, general, and other waste, including e-waste, as to what are the kind of things that need to be done at the hospital and also at the common biomedical waste facilities. These are the special guidelines which Ruth mentioned. Of course, the double-layered bag has been specifically mentioned because in India, some of the bags have been found to be rather flimsy and there have been instances of breakage. So I think to prevent that, the double bagging has been recommended. There is also the color coding that we have to follow the same biomedical waste rules. And so those which have to be autoclaved go to red. Then temporary storage room and separate storage and marking of COVID-19, including in the wards and also in the storage room, is mandatory. And all trolleys as well. Again, it says very clearly that it should be the trolleys and the bins and everything should be disinfected with hypochlorite. There should be proper reporting. There is, even in the isolation wards, it should be properly marked. And general waste should go only by the solid waste management rules 2016, not to overwhelm the system. And also the operation of, even from the sample collection center, it should go to the common biomedical waste facility. So here we see these are the kind of PPEs that are being used and given, to all that. These slides have been provided to me by R. Nisarg from Bombay, Mumbai. And like Ruth mentioned, that it is advised that these are kept after cutting in a paper bag for 3 days, 72 hours, and then disposed with general waste. But now even Mumbai is examining the possibility that it might go for a hydroclaving system before it is discarded into general waste, because there's a little bit of possibility that people are not following these protocols. Rational use, Dr. Malini will be talking more about this. I will not dwell too much. But the healthcare workers are making a big effort to see that PPEs are used rationally and not excessively. This is the common biomedical waste facility, just as an example, which is there in Gulbarga. Like you can see, in India, the incineration is only for the anatomical and the pathological microbiological waste. Most of it goes for hydroclaving. This is a hydroclave. There's a blade inside, plus a shredder and washing with hot water. This is ETP, and then there is also the chemical disinfection for glass waste and metal sharp manager, dry heat sterilization. So this particular facility has all, and then it has a vehicle with separate compartments and also HEPA filters. So here in COVID times, they have been sanitizing. Like you can see, like they have kept a wheeled cupboard where they are storing all the COVID waste separately. After every transport, it is being properly sanitized, and you can see that the workers are also wearing PPE. So some of the important challenges that we faced in biomedical waste, one is it's not just 1.5 times, now it's almost become double. Availability of safety of availability of staff is becoming really a problem because people are really scared. Fear factor is a big problem. Then there are some, there's a problem about resources because there are many hospitals, small hospitals which have closed and they're not paying. The burden has gone up and the resources have come down, and quarantine centers and homes, we don't know how much to collect, and the availability of cost and also the training part. That is a very big challenge that is being faced in the biomedical waste. But still, people are training. People are, like Ruth mentioned, how to put on the PPE, how to doff it, and various other training programs. So this is the pictorial guide. As you can see, this has been supported by the Healthcare Without Harm, prepared by the Center for Environmental Health, PHFI, supported by the WHO also, and endorsed by the Ministry of Environment and Forest, Government of India. This shows clear categories. This is the biomedical part of the hospital waste, and this is the non-biomedical part, because general waste also is there in some areas. I will be showing the pictures, and here you can see the transportation to the common biomedical waste facility in a proper vehicle. Here it shows the different categories of biomedical waste with appropriate color codes. The emphasis on is that biomedical waste rules have to be followed, and whatever needs to go into either yellow or red or blue has to go, and even the general waste is to be kept separate and treated as general waste and not mixed with the biomedical waste, and not overwhelm the system. Again, this one very clearly gives the various categories. We are very thankful to Yutika and Mr. Vinod Babu and the entire CPCB, which helped us in finalizing. And also it shows intramural transportation, that it has to be very safe and it has to be transported in wheelbarrows in the particular color codes. Again, management of spillage. Here also, you know, of course, we are encouraging that there should be no mercury-based thermometers or sphygmomanometers. But if they are there, and this is the way to deal with it, the same way with the body fluids and with chemical spillage. Here again, you see the blue category waste, that it has to be disinfected or autoclaved. And the emphasis a lot is on autoclave, especially for things like whatever is going to be recycled. And here it is in safe method, you know, like using hard cardboard boxes and rather than only plastic bags. Here again, we see management of metal sharps. Again, the emphasis on dry heat treatment. And this is just to show what a common facility looks like. This symbol, this icon is for common facility. Here again, it's common facility, saying that it can be done in a captive facility or in a common facility. So here again, you see the red category, which is, as I said, one-time plastics. But here again, the emphasis is on lot on autoclaving and microwaving, and whatever can be washed and cleaned and shredded can go to an authorized recycler. And so plastics are recommended like this. Even the COVID plastics are recommended for being put like shields or the splash gowns. All those are meant to be put only in red. Again, here you can see only the incinerable waste. As you can see in India, it is mostly anatomical, pathological, and only after autoclaving then goes to the incinerator. But otherwise, the emphasis is on minimizing. So these are the standards. So whatever is there in Schedule 4 of the biomedical waste rules have been shortened here, but have been mentioned very clearly. There was this poster was developed even before COVID. There was always an emphasis on good PPE, and like all the speakers mentioned before me, the important thing that we have to remember is we have to be safe always, and safe from several microorganisms and not just COVID. So as you can see here, the emphasis is on not to throw it into the municipal bin. Again, you can see here that the emphasis is again to safeguard yourself, to post access, and then you can also see that bad practices are avoided. Here again, you can see the general waste area from in a hospital is kept separate, and the biomedical waste is kept, the waste is kept separate. Again, this is the COVID posters, which clearly show that we have to maintain the same system and what are the things that need to be put into yellow and red. And this we have made it in English and Hindi. And of course, in the several states, they are probably planning to make it in their own state languages. This is only the camps, homes, and the home care facilities. They need to put it into yellow bags, but not the food waste. This is all the various other waste which comes, and including the diapers with excreta, and also the various tissues and other equipment that is being used for the COVID patients in the quarantine. So as you can see, the issues are basically segregation has been in the under the SWM rules in the community category has been a little difficult. Cost is again a big challenge. Dedicated staff in the community area, I think Dr. Ramesh Kumar will be talking about it. Safety of workers, also he'll be speaking about it. Guidelines for the quarantine homes also has been very clearly mentioned, that again double bagging, but from quarantine homes it has to go into yellow, but it has to go to the common biomedical waste facility and not to the incinerator. But unfortunately in some of the SDMC areas it is still going only to the WTE, waste to energy plants. These kind of discrepancies are still there. Additional points which CPCB has given, I already mentioned the excreta and collection of the PPEs such as goggles, face shields, splash-proof apron, coverall, hazmat suit, nitrile gloves only in red bag, and only the masks and shoe covers and disposable, the non-woven plastic, that has to go into yellow bags. Then the additional clauses for home healthcare has been also mentioned by CPCB, and used masks and gloves generated from home quarantine has to be kept in a paper bag for 72 hours, which as I told you is a little difficult. So we are examining the possibility of using hydroclaves. States not having CBWTFs and rural remote area, they can go for deep burial. So these are there's some IEC material provided to me from the MCG, from Municipal Corporation of Gurgaon. They are doing the double bin and a bag, and also the waste segregation guidelines. We have these. So they made some guidelines for the MCG also, and they have been following. But definitely the sanitary waste is kept separate, and that is only collected by the MCG. This is being provided to me by R. Nisarg. They have even provided sanitary kits and various disinfectants to Dharavi. but it is a big challenge. It is being addressed. The responsibility of local body is that they have to follow a proper SWM plan, and they have to make housing and marketplaces safe. They have to make bylaws and impose it, and also use a fee. So the same way, there are duties of all the public local bodies is for creating awareness and making sure that there's no littering, minimization of the generation of waste, and practice segregation, and also home composting and vermicomposting. This is being emphasized. So segregation, we all know, but the unfortunate part is I'm really unhappy to say that even in my own colony, I'm trying my best, but the community is not practicing very good segregation. So this is what actually the rules say. NIUA helped us when I was in doing the Swachh Bharat mission. We prepared this. I was the one who prepared it. And it clearly says that it is not to be overwhelmed. The sanitary waste, the domestic healthcare waste is supposed to be kept separately, and it goes to the common biomedical waste facility. And the dry and the wet has to be managed to the maximum extent in the home or in the community, but it can go to any common facility where it's being done. So also the dry waste. So IEC can be improved only through a lot of different types of educational material. And of course, in COVID times, it's very, very difficult because you're not meeting anybody and it's all virtual and digital, but still this has to be done in one way or the other. And in our several of the SDMC areas, we have tried our best to do some amount of training and education through word of mouth and through the various committees and RWAs. Like you can see, this is a good practice. This has been done in Ambikapur, and you can see the counselors are involved in the training. So also you can see in Indore, and of course the local body's responsibility is also to set up proper facilities for segregation. As you can see, especially for the informal sector, providing them training and also identity cards. Collection of plastic waste has to be done very, very carefully. These are some cities in south, down south. This is Ambikapur. Again, domestic hazardous waste is separately collected, and so also the disposable plastics. Indore, again, they have a very good practice: wet, dry, and the sanitary, the domestic hazardous. Again, local responsibility, local body responsibility. Wet waste, these are being provided by another group from Gurugram. They are doing training and education, and they have provided the PPE, and they are managing the food waste. You can see here that this is going on even now. Green Bandhu, but there are other organizations also which are doing it in their own, like Nirmana County and several other organizations which are doing community composting and localized composting. So the material recovery facility these days is very, very important. This is a good practice in Ambikapur, but unfortunately, I don't know, many local bodies are, I think Dr. Ramesh Kumar will enlighten us on this. So after segregation, unrecycled plastics can go for road making or for generation of fuel like diesel, petrol, and aromatics. Most important part is that we need to still educate people about different types of plastics and how things like we had an accident with styrene. So things like polystyrene and PVC need to be removed. Most important part is the behavioral change. And many people have asked me, what is this? You know, there's so much of plastics which is going up and PPEs. So it is all the more necessary that we remove the single-use plastic in unnecessary uses in our daily life, so that things like PPE can be used. Now all the waste is this single-use plastic, and therefore that's a big challenge. This is from Bengaluru. Hasiruddala has provided me with these and they collect their plastics right from homes itself. It is segregated, DWCCs. And you can see even from high-rise buildings, they do home composting collection. They also collect from individual households. They provide a lot of training, education, and proper facilities for the waste collectors. And they can either sell it to ITC WAR project, or they can sell it at the various other godowns. So in class 1 cities for sanitary waste, this is again from Bengaluru. They have been following a good practice. They collect it at their DWCC and then give it to the common biomedical waste facility. In remote areas, this is what we have tried for completely compostable sanitary napkins. You can do practice deep burial. So I stop here because then the rest of it I will show during the panel discussion because I need to cover about the how to manage the food waste and how not to mix it with the general waste. Thank you.
Thank you, Dr. Mani, for this interesting presentation. Our next speaker is Dr. Malini Kapoor. Dr. Kapoor is the Professor of Microbiology and in charge of biomedical waste at Vardhaman Mahavir Medical College and Safdarjung Hospital. She's a member of Ministry of Environment, Forest and Climate Change, Ministry of Health and Family Welfare, and Central Pollution Control Board Expert Committees for Biomedical Waste Management Tools, and also the recent guidelines for managing COVID waste. Dr. Kapoor will talk about the challenges faced by the healthcare establishments while managing